This is a very difficult market to operate in, a low-income context, in a peri-urban, low-income market. When you think about it, what are the biggest challenges that Access Afya faces right now?
To that point of it being a difficult market, and with any social enterprise operating in these markets, health or education, etc., there is the lack of infrastructure makes it a challenge for a social enterprise to execute on their specific goal and mission, without appreciating the system within which it operates, which is likely to be as underdeveloped as the solution that they're trying to offer. And so there's often a delicate balance that one has to find between developing the missing pieces of the value chain that are complementary to your services, and not even sometimes complementary, sometimes essential to the services that you're providing, but also remaining kind of mission focused and being able to leverage networks and partnerships to be able to, as a system, evolve and achieve those social impact goals as a whole. So operating in isolation as a social enterprise is virtually, kind of impossible without the infrastructure that you need to be able to support true success in that. And so that is still, that's just, factual. So there's nothing we can do about that. But we can, recognize it. We can continue to share more about it and improve the collaboration in that space to be able to achieve the kind of social impact goals that we have.
When you present your model to potential investors, what is it that they seem to like the most? What is it that's a real strength?
I get a lot of positive feedback on the impact. I think it's a very highly impactful business. So second to that is, particularly now, is alongside that is the ability to leverage a model like franchising for growth. So that is an emerging, interesting aspect of our model, particularly towards its potential impact on scalability and therefore sustainability as well, assuming unit economics are held steady. So a commercial market-based solution that's able to meet the needs of low-income communities in a very nascent market, I think is particularly attractive.
Talk quite a bit about Access Afya now. Is there anything else that we should discuss that hasn't been talked about yet?
I think the franchisees themselves, can't go without mention here. I'm a healthcare worker myself, and I was in clinical practice, practicing as a doctor in rural Kenya. And one of the major pain points that I felt working in the public sector is the inadequacy of the system and the support. And part of my own personal mission with the franchise is to empower healthcare workers to not feel under-resourced and, like their hands are tied, to be able for them to do the work that they need to do. So one of the other things that I think this is also quite transformative is not just in the job creation for healthcare workers and the retention of healthcare workers, where we have huge exodus outside of Kenya for people trying to solve that satisfaction problem by going, to better resourced countries and working there. By achieving that locally, alongside providing those essential jobs, not just for the healthcare workers in the clinic, but the community health workers as well that are attached to each location.